Hello, everyone, and welcome to an EAS Consulting Group webinar on food allergens and the FDA, presented by EAS independent consultant Steve Gendel. EAS, a member of the Certified Family of Companies, is a leader in regulatory solutions for industries regulated by the FDA. Our global network of over 200 independent consultants enables us to provide comprehensive consulting, training, and auditing services, ensuring proactive regulatory and quality compliance. From regulatory strategy development, compliance assistance with food safety and HACCP, preparation of technical submissions such as GRAS, food contact notifications, as well as support for receipt of FDA Form 483s, warning letters, and preparing for FDA inspections, EAS offers the detailed knowledge and experience your company requires to ensure accurate and timely assistance. Today's presenter is EAS independent consultant Steve Gendel. Steve works to protect public health and to leverage safety and integrity systems to enhance success and sustainability. His experience includes over 2 decades as a scientist, risk assessor, and policy coordinator in the FDA Center for Food Safety and Applied Nutrition, in academic positions at Harvard University, the University of Toronto, and Iowa State University, and as the Senior Director for Food Science at the Food Chemicals Codex. He has worked with food producers, consumer groups, regulators, and industry organizations in the US and internationally to evaluate and improve food safety systems to meet the challenge of food allergen management and to protect businesses and consumers from food fraud. Today, we'd like to ask that you submit any questions you have by using the Zoom Q&A feature, and we'll get to them at the end of the presentation. With that, I'll say thank you again for joining EAS, and I'll hand it over to Steve.
Thank you very much. And again, I want to welcome you all to this presentation today. It's good to connect with a lot of people who I've worked with in the past, and also to make some new friends and new connections here. Just as a way of getting started in the introduction, you heard that I have a number of years of experience in food safety and working at the FDA Center for Food Safety and Applied Nutrition. I just want to point out that one of my roles there at the end of my time with Sesame was as the FDA's first food allergen coordinator. So I got a chance as a coordinator to see all aspects of the food allergen issue from the point of view of FDA. So this included rulemaking, it included providing guidance, it included methods development and use, it included communications with users and with industry, with the field forces, and of course, it also included trying to keep all the different people involved on the same page with that. So I've been in this field for quite a while. What are the things that I would like to do? And now it's not moving again. Jessica, there we go. Let's try this. Okay. It's going slowly, so my screen doesn't change that fast. I apologize. I've divided the presentation today into 3 segments. The first is the past, focusing on the FALCPA law and what's happened with the industry after that. The second is, let me try this and see if this works. The second is to look at what's happening now and the developments that are in process in the short term. And then the third part is to spend a little bit of time talking about the future and what might be coming next, with the realization that one of the things that we have learned quite clearly over the last few years is the future is pretty much unpredictable. So that part will be a large part of speculation. So I thought it would be a good idea to start with a look at the actual Food Allergen Labeling and Consumer Protection Act and what's in it. I think this is an important thing to do at this point because a lot of people are familiar in a broad sense with what was in the law and certainly have familiarity with the things that they have to deal with on a day-to-day basis. But it's always interesting to look at the whole act and everything that was in it. I do want to emphasize that two things about FALCPA that have struck me at the time. One is it really is about labeling and consumer protection. So the fundamental purpose of the law was to provide clear English understandable information to food allergic consumers. The second thing is think about the fact that the rather awkward uh, abbreviation of FALCPA, which is not the easiest thing to pronounce, is a good sign of the fact that when Congress passed the law, they were really serious about the contents of the law, not so concerned with trying to come up with a fancy name that would have some political capital. So I think that's always something worth thinking about. So what is in the FALCPA law? So it has several sections. We'll go through and describe the major ones in the next slide here. The first one, as you saw on the last slide, is the title that calls, it says that Congress calls this Food Allergen Labeling and Consumer Protection Act. Section 202 is what they called findings. Findings are what Congress puts into an act like this to explain why they're doing what they're doing and the reasoning behind it and the information that they considered. This is the part of the act that contains the figure which people often quote that says that the major food allergens account for 90% of food allergies. I have never quite been able to figure out exactly what this statement means or where the information came from. It's probably in some committee reports or testimony that Congress looked at, but it is something which people have relied on as a source of information for the importance of allergen control since the law was passed. Section 203 is the section of the act which deals with labeling. So this is the heart of the matter for the industry and for allergic consumers. This section actually amends the Food, Drug, and Cosmetic Act, and it defines what constitutes a major food allergen. So this is the part where Congress identified the 8 major foods or food groups which are covered by the labeling regulations in FALCPA. That has had some interesting consequences, which we'll talk about later, that the fact that those major food allergens were actually written into the law specifically. The law also describes the formats that can be used for declaring the presence of these allergens. And again, this was designed primarily with the purpose of making sure that consumers had the information they needed in order to make informed choices at the grocery store. The other thing that's really interesting about this act is it did not require any agency rulemaking for it to go into effect. It just simply came into effect as soon as the law said. So labeling, the declaration of what constitutes a major food allergen was all built into the law. There was no proposal and comment rulemaking and so on that the agency needed to do to go into the process. That meant, of course, that the agency needed to do a lot of guidance documents and other information for industry, but it did not require that there be a rule put into the Code of Federal Regulations in order to make FALCPA effective. Section 206 was about gluten-free labeling, and we'll talk about that in a minute. Section 209 was about making sure that allergen labeling was addressed in the food code. The food code is a model regulation which FDA works with state governments to produce so that the governments at the state level have literally a model of a food safety law or regulation that they could implement in their jurisdictions. This is quite important because at the state level, much of what goes on in the retail food industry is governed by state laws and regulations. So it's important or helpful if all of the agencies, all of the governments across the country that do that have this model code so that they can be consistent and very up to date. So Congress instructed the FDA to make sure that allergen labeling and allergen control was included in the model food code to make it available for the states. There was also another section, Section 204, which required the FDA to make a report to Congress. And in that report, the Congress asked them to address the causes and frequency of unintentional contamination, cross-contact. How often does it happen? Why does it happen? How big a problem is it? This is important because the FALCPA in itself, the labeling part, only covered ingredients in foods. That is, only the things which are added intentionally into a food product. So in the report, Congress asked FDA to bring them up to date, or at least consider unintentional contamination. It also asked the FDA to do some work on advisory labels to find out how they are being used, how many different ones are available, what's going on in the industry with advisory labels. Advisory labels are things like may contain or may not have line, which also handles allergens. And it asked the FDA to look into consumer preferences for labeling, particularly for the advisory labels. And I bring this up because the FDA did submit the report to Congress, but it's interesting because these subjects that it talks about here are things that we're still wrestling with today. So that's an interesting look back on the fact that all of this is still in play today. So let's take a little bit of a look at the gluten-free labeling provisions of the law. I don't want to spend a lot of time on it because we don't have a huge amount of time today. Section 206 requires that the agency issue a rule to define and permit the use of the term gluten-free on the labeling of foods. How did FDA respond to that? Well, they responded by issuing a rule which defined the conditions for the use of the gluten-free claim in most foods. So this is the one that basically has several different criteria that you need to meet in order to define, to be able to use a gluten-free claim, including at the end of the list, the one that says gluten has to be below 20 parts per million in your food. And notice that it said claim for most foods. In 2020, the agency issued a second rule, which modified the first one, which added the conditions for use of the gluten-free claim for fermented and hydrolyzed foods. So the question is, why did they need two different rules for this, and why did they take place over a period of 7 years between the final rules? Well, it comes down to the lack of methods. In the first rule, where you're talking about intact gluten, the agency felt that they had methods that were adequate for enforcing the rule in the final products, and that industry could use for making sure that their products met the standards for gluten-free. And that was for intact gluten. However, they realized that fermented and hydrolyzed foods, when you start to degrade the gluten in them, it's not clear how you would relate the product that was left, the fragments of gluten molecules, to the 20 parts per million limit that for intact gluten. This is an interesting problem. I'm not going to go into it in detail, but simply what happened is the FDA decided, because of the lack of methods for testing the finished products after fermentation or hydrolysis, that they would require that the ingredients going into the fermentation or hydrolysis meet the gluten-free standard before the gluten was degraded. I also would like to point out that gluten-free labeling is voluntary. The law, FALCPA, specifically says that the agency should permit the use, but not require the use. That means that foods which do meet the standard for being gluten-free do not necessarily have to declare that on their label. But if they do declare it, then it has to meet the standard. And finally, after the first rule was issued, the agency did a sampling assignment where they took samples of products off of store shelves and checked to see whether foods which were carrying a gluten-free claim met the conditions of the rule. And good to say that out of 700 samples of more than 250 different food products, they only found one violative sample. So that looked pretty good in terms of what happened with the gluten-free part of the FALCPA rule. So let's look at the heart of it now, which is the actual FALCPA compliance, the allergen labeling compliance. And to do that today, I'm going to use 3 indicators that can show something about the FDA's view of industry compliance with the rule. And those are inspection citations, import refusals, and reports to the reportable food registry, which is equivalent to a Class 1 recall. We'll talk about each of those in a little bit more detail. So let's talk about the inspection citations. This inspection citation information was taken from FDA 483s that were created using an electronic inspection tool. This means that when inspectors go into a facility and do an inspection, they will look for potential violations of the Code of Federal Regulations or the Food, Drug, and Cosmetic Act. Whenever they find one, they will work with the facility, or they will write up a 483, which says you are in violation of this particular rule, and they will cite that rule from the Code of Federal Regulation. If they are using the electronic inspection tool, that information is then collected in an online database. This set of data does not include inspections done by the states for FDA. As you may be familiar with, the FDA has contracts with state public health agencies in quite a few states in the US, which authorizes state inspectors to do inspections on behalf of FDA. And those inspections are to look for compliance with the 21 CFR and the code and the Food, Drug, and Cosmetic Act. Those are not entered into this database. Was able to look at data on these inspections and their results from the year 2009 through July 1st of this year. So this information from this year is for half a year, but it is a pretty long stretch of samples over a period of time. So that's really good for tracking trends. I was able to find 964 inspections, 483s, that cited a violation of the 21 CFR related in some sense to allergens. Interestingly, those 483s cited different parts of the CFR when asserting that a facility was in some sense in violation of the rules. And they cited up to 21 different parts of the CFR. That at first seemed like a bit of a puzzle, because when you go back and look at FALCPA, FALCPA only had one thing that it did, which was to change the allergen, is to insert the allergen labeling regulations into the Food, Drug, and Cosmetic Act, and didn't even require that there be a rule in the CFR. So this was kind of puzzling at first, and the result of doing that, looking for why that happened, turned out to be quite interesting. So here is the list of those citations laid out on an annual basis. And I think that it's quite clear, you can look at it and see that clearly something happened right around the years to 2016 or so that completely changed the way the inspections were being carried out. You can see that the years 17, 18, and 19, there's a significant increase in the number of citations related to allergens in 483s. The 2020 and 2021 The lower numbers undoubtedly reflect the COVID issues and the lack of on-site inspections if they weren't in high risk facilities. And of course, the number for 2022 reflects only 6 months of the year and still some issues with COVID and COVID inspections. So the question comes up is, why was there a change that happened so abruptly and so significantly in the middle? Well, the answer to that turns out to be the preventive control for human foods rules. This is right at the period when this rule in 21 CFR 117 was coming into effect for facilities at different sizes over the course of a couple of years. And when FDA inspectors had been trained and were beginning to go out into the field and do inspections to look for compliance against 21 CFR 117. And as you probably know, 117 contains a number of places, both in the GMP section, in the hazard analysis section, and in the preventive control piece, and in the record keeping, that requires facilities to consider allergens as a potential hazard in their foods. So as the agency began to look at these and looked for compliance against these issues, you can see that they were finding a number of issues and problems with compliance. So this is important because this is really the first time that the agency recognized allergens as a hazard within this kind of rule. Previously, the GMP rules did not specifically address allergens. And secondly, it's really interesting from the point of view of hazard control, because the appropriate control for hazards is to either prevent the cross contact or to do labeling. And this is the first time that a label and a labeling system was taken as a hazard control measure in a food safety system. So I'm hoping that this means that as the industry becomes more and more familiar with the preventive controls rule and with the HACCP rules, that things like juice and seafood also include allergen requirements for the industries affected there, that these numbers will go down, and that what we see at the right end of this graph is not an anomaly, but actually represents improvement in industry's use and control of these allergens. The second set of information I looked at were food allergen import refusals. You all may be familiar with the idea that when a product comes into the US through one of the import stations, it's checked, or some of them are checked, for compliance with various aspects of the Food, Drug, and Cosmetic Act. And if the inspectors look at it and feel that there's the potential for the food to be violative of some aspect of the law, they can detain it or refuse entry. So you may hear the term detained without physical examination, DWPE is the term that's used for that process. The agency has a list, quite a large list, of the apparent violations that would subject a food or product or an ingredient to refusal of entry. In that list, there are two of them that are specific to food allergens. One of them is an apparent violation of the major food allergen labeling rule, which is, you also hear that referred to as 403W, because that's the place that it occurs in the Food, Drugs, and Cosmetic Act after FALCPA amended the act. And of those, over this course from 2006 to July 1st, I found almost 1,800 refusals of foods into the US. This other charge is apparent cross contact, for which there were 31 refusals. Interestingly, of those 31, 15 of them also carried an apparent violation of 403W. So the total number of import refusals was only just over 18, or was over 1,800, not just, but is over 1,800 food items that were refused entry because of allergen problems. You can understand why the labeling piece was more important than the cross-contact, because when you have a food product in hand, you're at the border and you're inspecting it, you really can't tell very much about how it was made and handled. All you can really see is how it's labeled. So it is a lot more straightforward to make a determination about an apparent violation of a labeling law than it is about handling and processing practices before it got to the US. Again, it's really interesting to look at the trends over time. And I think that except for the anomaly, the high number in 2011, there seems to have been a fairly steady increase in the number of refusals over time. Again, there seems to have been a significant increase that took place as the FSMA rules were put into place. I don't know whether any of that has to do with the food safety, the import rules that were put into place, the FSVP programs and so on. And interestingly, there was a slight drop, but not as much as we saw before, in the years where COVID had an impact on agency activities. And again, we see a fairly low number at the mid-year point for this year. It'll be interesting to see if, as activity picks up in the next year or so, whether that number will remain high. And obviously, over the last couple of years, the fact that the food supply chain has been so radically disrupted, it's interesting. It will be interesting to see how this pattern goes on over the next several years. The last indicator I want to look at here of FALCPA compliance and the impact of FALCPA and also of FSMA on allergen control are RFR reports for undeclared allergens. RFR, you should be familiar with it, is the Reportable Food Registry. It was created at the result of an instruction from Congress for the FDA to set up a mechanism by which companies could report to the FDA when they became aware of a problem in a food that could have health consequences. So the FDA created this registry. All facilities that are required to register with FDA are covered by this rule, and they are all supposed to report within, I believe it's 48 hours, when they become aware of a product in commerce that has a problem with it. The standard that the law put into place for what constitutes a reportable food is one that could cause what they call serious adverse health consequences or death to humans or animals, which is often called the Sakota hazard, another perhaps unfortunate acronym. But the important point here is that RFR reports, Sakota hazards, is the same standard that's used to determine whether a recall should be classified as a Class 1 recall. So RFR reports that come into the agency are evaluated by people within CIFSAN. I was part of the committee that worked on that while I was there as a food allergen coordinator. And the committee looks at these reports and determines whether they really are a legitimate problem that needs to be entered into the database, whether the information is appropriate, and then also to make sure there's a follow-up. And that follow-up is always a full Class 1 recall. So looking at RFR reports for undeclared allergens, and again, remembering that this is essentially the same thing as looking at class 1 recalls for undeclared food allergens, you have data from 2009 to 2002. I believe it doesn't actually go to 2002. I think it only goes as high as 2001. And there were 903 reports related to undeclared allergens. This is roughly about half of the total, or let me put it this way. It represented anywhere from more than a third to about a half of the reports in any one year. It continues to be the single leading cause of reports to the RFR system for class 1 recalls. And because the RFR system was designed to be an online data system, it is relatively straightforward to learn more details about these recalls and reports than it is in some of the other agency databases. So you can see on the left side the reports linked to each of the different major food allergens, and clearly reports linked to milk far outnumber the other major food allergens. But I think it's really interesting to look at the last category, which is multiple allergens. So these are reports linked to situations where a company or a food contains more than one major food allergen and none of them are declared. So this might be something like it says, you have milk, eggs, and wheat in here, and none of them are declared. So in those cases, it's more than just simply a problem with labeling, leaving something out. It seems to be a more important or major problem with allergen handling and the way the facility deals with it. On the right, you can see the foods that were most commonly associated with these RFR reports. The top 6 food categories accounted for just under 2/3 of the total reports. And in this case, you can see the bakery items far outnumbered the other kinds of foods, with prepared foods, candy, and snack foods coming up behind and about equal to each other. So this is really a worthwhile piece of information to have, because if you need to be doing your hazard assessments and you need to be determining what constitutes a known or reasonably likely hazard for your foods, this is the kind of information that you can use to determine whether your foods are something you need to look at more closely, or whether you handle the allergens that seem to be more problematic for the industry. This is the year-to-year data, and I'm sorry, it only went up to 2020, not 2022. My mistake on the previous slide. This is the year-to-year reports. And again, what you can see is a trend going up for a number of years, possibly leveling off after a while. And of course, then you see the decreases that were associated with the COVID situation on the right side of this. So what it says, or what you put all 3 of these together, what it says is that ever since FALCPA became effective, there have continued to be a number of problems in the industry with allergen control and allergen labeling. And quite frankly, this is undoubtedly going to continue to be a problem for some time. So I think it's important that people understand what's going on. They can use these data to help focus their attention on the most serious issues, and still need to think about, in terms of the spirit of continuous improvement, to really think about what's going on and how the industry can get better. So that's the part of the talk where I talked about the past and FALCPA and what's happened. Let's talk about what's happening right now and in the short term. And that is primarily related to what's known as the FASTER Act. And I will mention the comment I made before is FALCPA was a clearly get down to business, let's do it acronym. FASTER is one which perhaps has a little more public relations behind it. Again, I think it's a good idea to start by looking at the Act itself. So this is the front page, the beginning of the FASTER Act. And you'll notice that the FASTER as an acronym stands for Food Allergy Safety, Treatment, Education, and Research Act. So it has a lot of pieces to it that go beyond the things that you may know about at this point, most of which I'm not actually going to have time to get into today. The most important piece of the Act for the industry and for the allergic consumer is Section 2, which amended the part of the Federal Food, Drug, and Cosmetic Act that defined the major allergens, by adding sesame to that list, and by saying that the effective date for that amendment is this coming January 1st. So just like with FALCPA, FASTER literally wrote the sesame in as a major food allergen. It is written in by Congress into law. It was not FDA's decision or option to do that. And because they didn't change any of the labeling requirements for the major food allergens, FDA did not have to do any rulemaking to make this effective. And Congress decided when it needed to be effective, which is this coming January. So all of that, of course, is very important for the food industry. What does that mean if you're a food maker or you're an ingredient maker in the industry, and how do you need to respond to it? Well, first of all, should be a trigger to review and update your food safety plan, at least the parts that relate to allergen control. And this is a reminder that in 21 CFR 117, the preventive controls rule for foods, human foods, there is a section which says you must conduct a reanalysis, quote, whenever you become aware of new information about potential hazards. It strikes me that having Congress change the list of major food allergens is certainly new information about a potential hazard. And it is something that you should reevaluate allergen control plans and make sure that you are prepared for that change. What does that mean in more specifics? And I think there are things that everybody, ingredient makers, food makers, need to do, even if you think you're already well in control for sesame, because you need to think about these and you should document the fact that you have thought about these and what conclusions you make. So first of all, even if you think you're already in control, are you sure that all your suppliers are in control? This particularly will apply to suppliers who supply various kinds of seeds or spice products to the industry. Sesame has been used as a spice, or is used in some cases as a spice. It can be handled by people who distribute various kinds of seeds. So are your suppliers aware of the fact that sesame is now a major food allergen? And do they have appropriate controls in place? So what do you need to look for? Well, you need to look for potential cross-contact allergen control, both for you and your suppliers. You might need, if you have sesames in your facility or use sesame-derived products, to update your cleaning and sanitation validation. If you have sesame or sesame-derived products in your facility, does your cleaning process, is it adequate to remove the residues of sesame? If you do product or ingredient testing, you might have to update and validate that testing. What methods are available and what are you going to do to make sure that those methods work? You might need to update training of your employees. Are they aware of this change and do they know why you're doing all this reconsideration? Importantly, please review all your labels and ingredient lists. This includes your advisory statements. So if you are a facility which makes statements like may contain or processed in a facility that also processes type advisory labels, make sure that you have updated those to reflect the current situation. And finally, and importantly, make sure that the people in consumer affairs know about this and are ready. And this applies to everybody, whether you use Sesame or not, because as the rule comes into effect, you are going to be getting calls from consumers who want to know how this is playing out in your facility with your foods. And even if the answer is we don't have Sesame, we don't use Sesame, our suppliers don't supply Sesame, the consumers want to know that. So your consumer affairs people really need to be trained and updated on what's happening with this and be able to answer consumer questions accurately and quickly, not to have to put it off and get back to them later. The FASTER Act also included, very interestingly, a Section 3, a report to Congress that FDA has to make. And the important thing about this one is that the Congress asked for recommendations for a system for modification of the definition of a major food allergen. So Congress said, you know, we don't necessarily want to have to add new major food allergens into the list by law every time it's necessary. So they asked FDA, what do you think is a good way to create a framework which would allow modification of that list? And they said that you need to define the scientific criteria for defining a food or a food ingredient as a major food allergen. So basically what they did is they issued a challenge to FDA saying, okay, you know, if we don't want to have to do this by law every time something changes, we want to know, you FDA, what you think you would want to do in that situation. So what is FDA doing about Section 3? Well, the most important thing they're doing is a draft guidance that they issued several weeks ago, very new off the press, with this very long title about evaluating public health importance of food allergens. Now, it's really interesting because this document is very clearly intended to evaluate only food allergens which are not already major food allergens. So that's where the food allergens other than major food allergens listed in the Federal Food, Drug, and Cosmetic Act comes from. The FDA in the guidance refers to these as non-listed allergens. So the document is intended only to evaluate what they call non-listed allergens. And it's only intended to evaluate foods, ingredients, or products which have been on the market in the US for a period of time. This is not for evaluation of new foods or novel ingredients. Those are both interesting decisions. The agency identified 4 factors that they felt were relevant to a public health evaluation. Those are, as stated here, evidence that the food or ingredient causes an IgE-mediated food allergy, information on the prevalence of that IgE-mediated food allergy in the US population. So the idea here is that even something which causes an IgE-mediated food allergy, if it's extremely rare, that's probably not a high priority public health issue. It's an issue, but probably not a high priority one. The severity of the IgE-mediated food allergic reactions is a factor that the agency wants to look at. Do the people with this IgE-mediated food allergic reactions have anaphylaxis or other serious complications or reactions when they're exposed? And a factor which they call allergenic potency, which is something which is somewhat new to the whole field. And this is one which says how much of the offending food or ingredient or protein does an allergic person need to be exposed to in order to have a reaction. So again, if there's a potential allergen, something which might qualify as being of public health importance, but you have to eat a huge amount of it to have a reaction, that's of less priority than something where a tiny amount will set off a reaction, at least in FDA's thinking. So those are the scientific factors that they suggest that they would like to evaluate. They also have information on how they will identify and evaluate the body of evidence that they will use for making this determination. Those steps include doing a preliminary identification of relevant published scientific literature, doing a preliminary identification of what they call community reports, and then doing a systematic evaluation of this published scientific literature and community reports. Now, from reading the draft guidance, I think it's important to emphasize the fact that when the FDA is talking about community reports, they don't mean the community of food allergic consumers or consumers in general. This is a term that they use for data that's obtained by sources such as government agencies or medical groups and so on that don't get published in the peer-reviewed journals, but do serve as a repository of scientific data that's available for the agency to evaluate. So as an example, the type of database that the agency might look for as a community report is the FDA's adverse event reporting system. They will look in there and see if they have adverse events that appear to be allergic reactions linked to a food. They can also look at reports from other government agencies. Maybe they'll look at things from insurance company databases, for instance, those kinds of things. That's what they mean by a community report. The systematic evaluation of the data is kind of interesting. So the agency has said that they will do that by taking the broad list of published literature that they found and evaluating the papers to see which ones meet pre-established data quality standards, and then use those in making their scientific evaluation. This will lead to an evaluation. First of all, the evaluation is of the quality of the paper and the research. Then the second step here is an evaluation of the strength of the evidence they have identified. Third is a similar kind of evaluation of the data in the community reports. And finally, an evaluation of the severity of IgE-mediated food allergic reactions. And the FDA has proposed a scale that they will use to determine what they think is a severe reaction. Now, this piece of the guidance is somewhat confusing to me. So I'm not quite sure why the systematic evaluation of the strength of identified evidence is separate from the systematic evaluation of community reports, for instance. That's all an evaluation of identified evidence. But be that as it may, for each of these, the agency has proposed to do this, and they've proposed some guidance or some scales that they will use in order to carry this out using predefined standards. So in other words, they will decide how the data is evaluated before actually looking at the data. And that's a common approach to doing systematic evaluations based on literature reviews. So a couple of points I want to make as summary of this draft guidance. The first of all is the guidance sets a very high standard for data. It requires a lot of really high quality data. If people want to get that data, those data, it will take a lot of time and money to gather sufficient data, particularly on US populations. And interestingly, it does not address using these analyses to remove an allergen. So the FASTER Act specifically says they're asking the FDA to suggest a way to modify the definition of a major food allergen. And the FDA says that this draft will only be used to evaluate things which are not already major food allergens. So they are not looking at a way to remove a major food allergen from the list, only to see if it's possible, even giving the high bars we have here, to add something to the list. And finally, there is really very limited, if any, opportunity for input from allergic consumers, the public community, and their families. And it'll be interesting to see how that plays out in the response that the agency gets from those people whose lives are really the ones that are most directly affected by the decisions and the evaluations we're talking about here. So quickly, in the time we have remaining, I'd like to make a few comments on things looking forward and what's coming, with the caveat that I gave before that the future is totally unpredictable, as we've seen as supply chains go crazy, as the world changes rapidly. So a couple of other issues. Advisory labels. As I mentioned, going all the way back to FALCPA and before, there is no particular guidance on the use of advisory labels from the FDA. All they will say is that these labels must be truthful and not misleading. There is no indication about wording or how this is supposed to be presented, and there's no indication there will be any action on this in the near term. Free-from labeling. This is sort of the opposite of the advisory label. People can claim that their food is free of a allergen, all allergens, some allergens. There is no, again, indication from FDA about when and how it's appropriate to use these claims, except that, again, it should be truthful and not misleading. And as I said, for the advisory labels, I don't see any indication that the agency will be doing anything about this in the near term. The other issue that the industry has been very interested in and has been pushing on for a long time is the concept of regulatory thresholds. Is there some level of allergens that could be present in a food, but be so low that it doesn't constitute the necessity for either an advisory label, an ingredient label, or extra efforts on the part of the industry? This is equivalent to some of the other agency efforts to establish thresholds for regulation, or areas like for filth, to say, well, it's below a certain level, it's unavoidable, it's natural and unavoidable. Well, for allergen regulatory thresholds, it's a quite complex problem. One of the reasons is because many of the allergens occur as a particulate with non-uniform distribution in a food. So if you want to look at a food and say, we think that something is below, I don't know, pick a number, 5 ppm. Well, the problem is that a consumer might take a bite of the food and find that because the particulates are there and they're not uniformly distributed, that one bite of the food might have 0, and the next bite of the food might have hundreds of ppm, maybe thousands of ppm of protein in it. So setting a regulatory threshold is very difficult when you have particulates in non-uniform distribution. There's limited data on different forms of the same allergen. So for people who are, for instance, allergic to milk, how is the threshold that you might develop for whole milk going to apply for whey or for casein or for hydrolyzed casein, all of which are different forms of the same allergen? And of course, there's ongoing issues with methods, namely, are the methods really precise enough to allow some sort of determination of a regulatory threshold at very low levels? And finally, one of the things that I find most distressing is that regulators don't always have access to the data used in a scientific publication. So a publication might present the results of data gathering and analysis, but the agency doesn't actually have the data that were used in order to do its own evaluation. To me, this is important because it limits transparency of the decision-making and also prevents reproduction of the analysis. So if somebody does a lot of work to gather data and they do the analysis, nobody else can reproduce that analysis to confirm that they reach the same conclusions. Also, in terms of the issues of regulatory thresholds, A little bit of positive news about things that are going forward. In 2021, the Food and Agriculture Organization, the UN, convened an expert panel to discuss a number of these issues, and FDA experts participated. So they are very aware of what's going on internationally, and they're looking at the data that FAO evaluated. They looked at revision of the priority allergen list, and they considered establishing reference doses for these allergens, which is really the first step towards setting thresholds. And it's a really important thing that they were able to do. So let me give you some final thoughts, because we are going to be coming up against the time limit here in a couple minutes. One of which is that regulatory environments change slowly, and that's a good thing. So if anything is going to happen, the industry will have plenty of forewarning about it and will have a chance to have input into that change. If you are currently in the industry, you're making foods with major food allergens, you're supplying ingredients with major food allergens, my message is, of course, to remain careful in your facility, make sure that you have control and that you are controlling things. Please make sure your systems are good to prevent mispackaging. That's a major problem for the industry. And to be vigilant about problems in the supply chain. I don't need to tell you why that's important now, but I will just say that the best approach to your supply chains is simply to trust but verify. So that's the end of the formal presentation I have. I would be more than happy to discuss this or any particular topic that arises from this with you individually or through a company. And my contact information, email, and LinkedIn profile are both on the screen here. And with that, I will say thank you for now, and I will turn the microphone back over to see if there's any questions that we should address right off the top. I will say that to the extent it's possible, I will try to address all questions that were submitted, even if we don't get to them today.
Thank you very much, Steve. And yes, I think we are going to run out of time to answer any during the presentation, but we are going to do our best to respond to everybody individually and get you some answers for your questions in the next day or so. And we'd like to thank you all very much for joining us, and we hope you have a wonderful afternoon.
Thank you all.